Okay, good afternoon, everybody. Day 31 for me, and happy to be here with Dr. Alexander Scott and Tom McCarthy, our Executive Director of the state's COVID response, along with Secretary Pryor, who'll be available for questions today. Also with us today is, in the front row, is my nominee for Lieutenant Governor, Sabina Matos. So I wanted to make sure that everybody was familiar with the fact that we're going to make sure that the new Lieutenant Governor is up to speed on everything that's going on relative to COVID and other related matters. So Sabina is stepping into this role in time of unprecedented challenges for our state, and I want Rhode Islanders to know that she will be a crucial partner in our COVID-19 response and our effort to get shots in arms as quickly as possible and our path to an economic recovery, along with reopening our schools from this pandemic. We have a couple updates today. Tomorrow morning we'll be releasing roughly 12,000 vaccine appointments. In total, we'll have an additional 25,000 doses available for distribution next week. 12,000 will be opened up for appointments tomorrow at 5 p.m. Happily to report that the New York Times continues to report on our progress. We rank in the top 10 percentages of vaccines administered in the country, and we'll continue to work to make sure that we are doing everything we can to get shots in the arms, and the results will speak for themselves. There are fewer tests being done compared to previous months, but that's because of vaccinations. We still are outpacing other states on testing, and we want to continue to do that, and we encourage the people of the state of Rhode Island to get tested regularly as we try to restore and get back into our normal economic opportunities that we want to open up. So keep getting tested, especially as you're coming back from a spring break or a trip of any kind. Continuing to get tested frequently helps us catch positive cases early. It's especially important to be able to do this with the presence of the variants in our communities, and Dr. Alexander Scott will be talking about those issues very shortly. We're also on track to expand vaccinations to the next age group. Rhode Islanders from 50 and over, 50 to 59, will be eligible to register for a vaccine on Monday, April 5th. There are more vaccine sites ready to open in Westerly, Johnston, and East Providence next week. Tom will have more details on that in his comments. The number of vaccines coming into Rhode Island continues to increase. More supplies allows us to expand vaccination efforts. 10% and up to 16% of the doses each week will be set aside for high-risk population, including members of the communities of the BIPOC community or the communities of color. I mentioned that last week, that they're trailing in terms of the percentage of vaccinations, and so we're intentionally making sure that there's a catch-up there, as we would with any community in the state of Rhode Island. A reminder, if you haven't yet signed up for the state's vaccine interest notification system to be notified when an appointment becomes available to you, visit portalri.gov to sign up. And I just actually had a text before I got on stage. People was wondering whether there was a place where they could pre-register and then be notified when an appointment becomes available. That's at portal.ri.gov. We're also making strides in vaccinating our most vulnerable populations, from homebound individuals to people experiencing homelessness. Tom will talk more about those strategies and will be available to questions to talk about those specific reach outs to these populations. Almost 230,000 people have been fully vaccinated in Rhode Island, and we've administered more than 500,000 doses in the last 3 months. This is good momentum, and we're going to keep it going. Addressing some of the concerns that have been brought up, there are a lot of mixed messages out there about how safe it is to move ahead with reopening measures. And there are concerns about the COVID-19 variant B.1.1.7. Based on what we're seeing, we are estimating that 40% or more of current cases are due to this variant. And so we're talking about this incremental flexibility on our reopening the economy. We're going to continue to take close looks on what's happening into both the infection rates, hospitalization rates, and God forbid any other death rates that could happen in the state of Rhode Island. But it's still a serious matter. So my message to the people in the state: let's stay disciplined, especially coming off the holiday seasons, the holy seasons that we're currently in, and will be celebrating. Many will be celebrating Easter this weekend. So we're going to keep on this incremental approach, and we're going to make sure that we're opening up at a pace that we can absorb it from a safety point of view. And we're going to, just other states have taken a more aggressive point of view, and if you look at some of the states that have taken that 100% opening strategy, they are now tracking back. We're not tracking back, but we're not going to get ahead of ourselves, so we put ourselves in that position. So we're still limiting the size of social gatherings in Rhode Island, and we will continue to closely monitor our public safety numbers and our vaccination progress throughout the reopening process. We did see increases in cases from 10 to 14 years old, and there are a few reasons that we are seeing that. Many are occurring outside of the structured school settings, but we're definitely focused on that because we want to see a reopening of our schools before the end of the school year, because it's important for us, for the students. So we're going to take a real close look on that to make sure that that doesn't get in the way. The Commissioner of Education will be here next week with a more detailed strategy of what's going to happen after the April break. So let's continue to be disciplined, wear a mask, keep our distance, wash your hands, get tested, plan activities outside versus indoors. We've got a really great team analyzing every piece of this puzzle to make sure we're making decisions that keep Rhode Islanders safe and that allow for a safe, responsible reopening of the economy. Some of the school updates that I can just give you in generally, and like I more specifically, the commissioner, I just spoke to the commissioner and asked her to be here with us next week and going onwards on the stage here so that we can keep everybody abreast of what's happening in the schools. Good news is that more than 89% of our teachers and school staff are now vaccinated. Students will continue to follow strict protocols, everyone wearing masks, and we have HEPA filters making sure that the air will be clean as we reopen our schools fully. So starting April 26th, we're continuing our reopening efforts. Schools will be able to space students 3 feet instead of 6 feet apart. This was already happening in elementary schools in the state, and settings with cause for very little concern, if any. This school update does not mean that the definition of a close contact for contact tracing has changed. Bus capacity is increasing to 75%, and cafeteria usage will be expanded, and we'll continue to keep the safe protocols in place to make sure that we are keeping everybody safe. In addition, child care providers will resume 100% capacity in their school-age classrooms effective April 26th. This will bring all child care centers back to pre-COVID capacity numbers across all age categories. And as a reminder to all our child care facilities, there are still grants available for child care providers between $3,000 and $50,000. We're really encouraging anybody that's associated with a child care to make sure we take advantage of getting those dollars out into our system, and they can apply at kids.ri.gov. Finally, if you're hosting a large-scale event planners should submit their plans to the Department of Business Regulation as soon as possible, dbr.ri.gov, and we've had many calls about what's going to happen on July 4th. Hopefully we'll have some really good information next week, but the point is if you have a parade or you have a function on July 4th, as you get in there, let's make sure we contact Department of Business Regulation so that we can go through the protocols with you as they currently exist, and we'll certainly be flexible as we get more people vaccinated. So please don't put off making an appointment if you're eligible. It's a race to vaccinate against the new variants and into the summer months. And I hope you folks are extra careful this weekend with Passover ending and Easter Sunday around the corner, and we do all the things we know to keep people safe. Please get vaccinated. Keep a neighbor safe by helping them get vaccinated. wear a high-quality mask, and keep your distance. And with that, I'll turn over the microphone to Dr. Nicole Alexander-Scott. Doctor?
Good afternoon, everyone. Happy April. We're going to jump in, as is our custom. I will start with an overview of our data. We have 383 new cases to report today. That's out of 18,109 tests, which is a percent positivity of 2.1%. We have 131 people currently hospitalized, and we very sadly have 5 new COVID-19 associated fatalities to report today. Our condolences go out to those families as well as all families who have been impacted by COVID-19. As I said last week, our case numbers have plateaued. That plateau is actually now starting to have a slightly upward slope. This is the case in Rhode Island, and as you are hearing around the country, it is also the case in many other states throughout the country. Last week, our total case count increased from 2,350 to 2,799, while our percent positivity increased from 2% to a weekly percentage of 2.4%. Also, in the most recent week, we saw some amount of increase in cases in most of our cities and towns. 24 out of 39 cities and towns have had some type of increase. Some of the communities where we are seeing particular increases are Middletown, Bristol, Smithfield, and parts of Warwick, West Warwick, Providence, and Cranston. Our hospital admission numbers and our fatality numbers have been trending downward for the past 2 months, and they are continuing to remain relatively flat. However, it's important to note what we do understand, which is that these measures, hospital admissions and fatality, tend to lag our case numbers by at least about 2 weeks and sometimes longer. One thing we do have working in our favor as we talk about this and acknowledge this is that we have had such a focus on vaccinating, particularly our more vulnerable populations in Rhode Island. These are the individuals who are most likely to have serious health outcomes from COVID-19, and it's why it has been a key component to our vaccination campaign focus. Since the beginning of January, we have reduced our case fatality rate by more than half. Those are lives saved, your loved ones, your neighbors, your coworkers. A big part of this reduction in our case fatality rate is because of our focus during phase 1 of our vaccination campaigns on nursing homes and other congregate settings. 84% of people 65 to 74 years of age have been vaccinated in Rhode Island. This is amongst the top percentage rates in the nation. And 80% of people 75 and older have been vaccinated as well, which is really strong news. And we definitely want to continue that as we move through each of the age eligibility categories. As the governor has shared, Rhode Island is doing very well with our COVID-19 vaccination campaign. We are a national leader. That's not a surprise. We are from a testing standpoint, and we knew what was needed and have built on that to be the national leader that we are with our vaccination campaign. But the equilibrium that we are in terms of seeing some new cases while the vaccine campaign is rolling out strong, gives you a sense of how easily B.1.1.7 variant cases of COVID-19 can spread. We have said that the variant is 50% more contagious than the wild-type version of coronavirus that causes COVID-19. Because of that spread, it is critical for us to get everyone that we can vaccinated as quickly as possible, as soon as we have the supply. We expect that the B.1.1.7 variant, which is one of the newer ones, is the dominant strain and could be so in Rhode Island at some point in April. It's the dominant variant and could be the dominant strain of coronavirus in Rhode Island as soon as April. That means that the types of coronavirus that are out there are continuing to be more and more transmissible. And we have now identified a case of the P1 variant in Rhode Island as well. Many people in Rhode Island have immunity to COVID-19, either natural immunity or those that we are vaccinating. But it's important to understand that many people still do not. This is why we need to continue to vaccinate as many individuals as we can, with a deliberate focus on our communities that have been hardest hit, such as and including our communities of color. We've been doing some very important planning with our Equity Council over the last several weeks, and we're confident in the plans that we have together to continue focusing on narrowing the gaps that still exist. One example of many is that we're working with Providence 311 and the Beat COVID line in Pawtucket and Central Falls to get appointments for people in our communities where the zip codes have the higher rates of cases and hospitalizations, so that they can have direct access to the Dunk and Saconaset mass vaccination sites. This is one of the ways that we are getting the percentage of doses administered to the level that we want to across all of the groups, particularly those who may be most vulnerable. We look forward to continuing to engage with our leaders from the communities who are setting the stage and being the example of helping to make sure that we're able to reach everyone who wants to get vaccinated as we have the supply available to do so. On top of that, we will continue taking our more traditional steps to prevent the spread of COVID-19 in all of our communities in Rhode Island. This is especially true, as an example, for this weekend that's coming up. We have our Easter and Passover holidays. When you look at it, this year, we have a lot to be hopeful about. We're in a very different place than we were at this time last year, when we could not see our loved ones in nursing homes and assisted living facilities. If you recall back to that time, things were so dire last spring that we were urging people to not even go to the windows of their loved ones in the nursing homes. And we were urging people not to gather in groups any larger than 5. We are definitely in a better place now, so we're going in the right direction, but it's important to know that we have to stay vigilant. We are much better at treating COVID-19, so we want to make sure everyone has access to treatment. And we are administering thousands of doses of a highly effective vaccine. However, we also know that holidays have caused us some difficulty in the past. We saw a huge spike in cases after Thanksgiving, Christmas, Hanukkah, and New Year's. We cannot let that happen again. We're asking you to please still err on the side of caution, particularly for this holiday weekend that's coming, and certainly for going forward. Here are some suggestions. If people are going to be seeing extended family this weekend, celebrating outdoors is always safer. If you are indoors, seating people farther apart is important, and mask wearing is very important as well. As we have continued to say, masks work. They are one of the most effective tools that we have to prevent the spread of COVID-19. If you are with people from outside of your household, whether indoors or outdoors, but closely interacting, and they're not from within your household, that's considered a social gathering. Social gatherings at this time are limited to 2 households indoors and 3 households outdoors in terms of the individuals that you should limit your social gathering to. The rule of thumb is to keep your groups stable and to keep them small, particularly as we are going through this time frame. Many houses of worship, especially for this coming weekend, are having in-person services this year. But many are doing virtual services. If you're more comfortable participating in a virtual service, that is perfectly fine. It's actually what we encourage. It's the best thing to do to be able to continue to worship virtually and safely, particularly if you're an older adult who has not been vaccinated yet. So thank you to all of the houses of worship leaders who are out there and setting that example, making virtual services available, knowing that we fully support and encourage that. Something else people should consider, particularly as we're approaching holiday times or just wanting to get together more, is really remembering the resource that we have in Rhode Island of getting tested. You can get a same-day test at sites throughout Rhode Island by going to the same portal.ri.gov that the governor spoke of. If you're going to be seeing someone for the holidays who you don't live with, just get tested first. It will give you some peace of mind. It's a great way to protect your household and to also keep your loved ones safe. Our traditions are very powerful in grounding us and bringing solace, particularly during challenging times such as this. And this last year has certainly been just that. Definitely has been a challenging time. We want people to participate in the holidays this year and to experience the joy of coming together and supporting each other. We also want to ask you to just do that cautiously. Okay, the 3 items I always hit on and are the ones that are going to see us through to the end of this pandemic are testing, treatment, and vaccination. I've mentioned how important it is to get tested if you plan to see family for the holidays. We've talked about our vaccination campaign and how strong we are, echoing what the governor has said. Please get vaccinated when you are eligible. We have more and more vaccine that we are working on coming to Rhode Island each week. We want to make sure also from that vaccination standpoint that you continue to access the information that you need to best understand everything there is to know about COVID-19 and how you can protect yourself and your household. We're working hard to get information out into the community in a variety of languages and to get people's questions about COVID-19 answered in multiple languages as well. We're even doing a texting campaign to make sure we get clear, accurate information about COVID-19 directly to you and to your loved ones. So keep an eye out for those messages and go to covid.ri.gov/ vaccination if you have any questions about COVID-19. We have a lot of great information posted there, and again, it's all available in more than a dozen languages. If you're listening to this, be an ambassador, help spread the word, provide information to individuals about COVID-19 and why it's so important to get vaccinated, to continue to get tested, and to access treatment if you need it. Speaking of that last item, treatment. If you test positive for COVID-19, talk to your doctor about treatment, especially if you're older than 64 years of age and if you have a high-risk condition. And if you don't have a doctor, that's fine. We are still making sure that treatment is available for you. You can just go to covid.ri.gov/treatment to learn more. We have great vaccines. We're continuing to lead with testing, and we also have an excellent, highly effective treatment for COVID-19 that we want everyone to continue to access so that we can continue to take the paths forward to a great summer here in Rhode Island. With that, I'll pass things on to Tom for some more details operationally on what we're doing.
Good afternoon, and thank you, Director and Governor McKee, for the updates. As the Governor and the Director shared, we continue to sustain great momentum in the vaccination campaign to date. We've administered 67,059 doses of vaccine last week and anticipate administering another 72,000 doses of vaccine this week. We've had an administration rate higher than 90% for the last month, and the only reason that administration rate is not even closer to 100% is because we need to hold a small buffer to ensure that we can administer successfully on Mondays and Tuesdays and account for any potential issues with the flow of vaccines coming into the state. Our administration rate is high across the board, and our uptake rate is high in the individual groups that are currently eligible. 79% of people older than 75 have received at least one dose. Those numbers are 84% for people 70 to 74 and 80% for people 65 to 69, with 56% for people 60 to 64. Because we have those strong uptake rates, and because, as the Governor shared, we're releasing so many new appointments tomorrow afternoon for our existing eligibility groups, we're on schedule to expand eligibility statewide to people 50 to 59 next week. People in this new eligibility group can sign up to be vaccinated at pharmacies and other small sites beginning Monday. However, after tomorrow, our next large batch of appointments for the mass vaccination sites will be posted on Tuesday morning at 9 a.m. Another exciting development for next week is that we'll be vaccinating at the new regional clinics in Westerly, East Providence, and Johnston. Each of these clinics will be administering 1,200 doses a week. The Westerly site will start operating on Mondays and Wednesdays from 9 to 3:15. The East Providence site will run on Wednesdays and Fridays from 9 to 3:15. And the Johnston location will start operating on Tuesdays and Wednesdays from 2 until 7. Now, these days and times may change and expand as we continue to receive more vaccine into the state. People can make appointments for all of these sites through vaccinateri.org. Opening these sites and taking steps to get our vaccination rates as high as possible in our hardest hit communities is in line with our commitment to expanding access to vaccine. We want vaccine to be as accessible as possible for all Rhode Islanders. Everything we're doing right now is about eliminating barriers to vaccination and increasing ease of access. Along the lines of increasing access, we've worked hard to get vaccines to a number of specialty populations. We've administered more than 6,000 doses to people with intellectual or developmental disabilities through targeted outreach we've accomplished. We've talked about our program to vaccinate homebound Rhode Islanders. We've administered more than 1,000 doses to people who can't get out to a clinic. If people need to get added to this list, they can either go to covid.ri.gov/vaccination, call 211, or call Rhode Island's Office of Healthy Aging helpline, The Point, at 401-462-4444. And finally, we have worked with community organizations to vaccinate more than 600 people who are experiencing homelessness in Rhode Island. Another major effort underway is the pre-registration system that I described last week. By pre-registering with our vaccine interest notification list, you'll receive a notification when an appointment opens for you at one of our mass vaccination sites, as opposed to continuously checking vaccinateri.org. People can pre-register on the vaccine interest notification list at portal.ri.gov or by calling 844-930-1779. We're going to start sending notifications about appointments next Wednesday, and we'll continue sending notifications on Wednesdays following that. People will be contacted either through email, text message, or phone call, and they will receive a one-time use link to make an appointment for a slot that will usually be about 2 weeks into the future. For most people, there will be some flexibility in the time of the appointment, but it will be for a set date and a set location. The link will be valid for 24 hours. If the person does not respond within 24 hours, their spot will be made available to someone else on the list, and they'll be returned to the waiting list. We tried to strike a balance between giving people enough time to get that link and register, but also not letting too much time pass before offering up the appointment to someone who's ready to get vaccinated now. One thing that people should note is that while notifications will start going out on Wednesdays, people could get notifications on subsequent days for appointments that were not taken up by the first people they went to. For example, you might get a notification on a Thursday or a Friday about an appointment that someone else didn't take after it was offered to them on Wednesday. People should also note that you won't get a notification with an appointment if you're currently not eligible. And even within each age group, we'll be sending out notifications for appointments 2 weeks in the future based on your risk level. That means that even if you are age eligible, you might not get a slot that first week. However, even if we don't have an appointment for you, we will still send you a message confirming that you are pre-registered and that we will contact you as soon as an appointment opens up. We have 79,000 people in our pre-registration system and are excited to begin booking appointments off of that next Wednesday. One last reminder on this topic, people can still make appointments through vaccinateri.org without pre-registering the way that people currently do. Pre-registration is simply one additional avenue that we've created, but it is by no means required. And of course, people continue to book appointments without accessing the pre-registry through our pharmacies and other partners. So we'll leave it there for today, but before opening it up to questions, I want to recognize the team and our partners that are working for Rhode Island 7 days a week, days and night, to keep these systems running and keep our administration so high. I'm here on Thursdays along with the Governor, Dr. Alexander Scott, and Secretary Pryor, but there's a whole team of dedicated public servants that make this all work. It's a team I'm very proud to be a part of, and a team that's going to continue to deliver excellence through the home stretch here. So with that, I'll open it up for questions.
Dr. Scott, throughout March and April of 2020, the Rhode Island Department of Health COVID dashboard featured 2 model estimates which claimed during that period, between April 27th to May 3rd, the peak daily census for COVID-19 hospitalized inpatients in Rhode Island would reach somewhere between 2,200 and 4,300 patients. The actual peak census for inpatients during this first wave was 375. Effectively overstating the potential damage 6-fold to 11-fold than these models. Who specifically at Rideau and Brown University is responsible for these models, and are any of these individuals currently tasked with modeling? And of course, the question every week, when will it be appropriate to unmask and fully reopen the state?
The purpose of modeling is to project out what could happen if you do not put in place the interventions needed to prevent that from happening. So each time we are assessing the models, the goal is to help ensure that we never reach what is actually projected. So
What is then, is there a math component to say the worst case scenario, or are we going to continue to be fed data which induces fear, panic, and quite frankly, the after effect is cynicism?
if you notice, we do not share the models on a regular basis as using that as a driver. It's a piece of information that helps inform the types of interventions that have been in place. And each time we have updated it, it has been so that we can make any decisions necessary to help prevent that from happening. And I would say that has been done quite effectively. In terms of your second question, we are going to continue with masking and continuing to remain vigilant given what has been shared with the variant that's in place. And as we go forward, we will make adjustments.
One follow-up question. There are multiple credible reports of what I'll call obscene living conditions in the ACI, in the Cranston facility. A current prisoner, amongst many, cites the absence of mental health, prescription medicine. That shortage is blamed by the ACI on the pandemic. There's commingling of infected and COVID-free inmates. And I'll quote, an environment that has filth, mice and roaches roam the prison, scavenging for any type of food, human bodily fluids left on the walls of the cells, leaking toilets, fluids dripping, mold in the walls. Additionally, just 2 months ago, there was an inmate who passed for still unknown circumstances, and Mr. Jose Franco passed on February 9th. Inmate's family has still yet to be notified of the cause of death. My question is, how often does the Department of Health and their representatives inspect the ACI? What, if any, oversight does the Department of Health have over the Department of Corrections with regard to the basic safety of inmates and their constitutional guarantees not to be subject to cruel and unusual punishment?
That is a question that is separate from COVID, is definitely a story that is of concern and one that we will continue to evaluate, or will certainly look into and evaluate, knowing that corrections also would want to make sure that the right setting is in place for their inmates.
Have to do with COVID. I mean, if they're being not given their medicine because, and the ACI, which is a state function, is claiming it's because of the
We get on to
pandemic.
other questions that other people want to ask. You dominated in your early stages.
Okay, don't answer the
I need to make sure everybody gets a chance.
Doctor, I noticed you did not use countries of origin when describing the variants. Is that going to be the way that the Department of Health presents variants going forward? And would you like to see the media reflect that when describing variants?
We definitely like to focus on the scientific terminology that we are associating the variants with. We do understand that people have connected the B117 variant with that being the UK variant, for example. We certainly encourage and want the media and the public to be informed of the scientific term for it as well.
Will we see Brazil, other names like this, on DOH documents going forward?
If we need to, so the people have an association, but we want to make sure people are also familiar with the scientific form of the variant.
Yep, Dr. Alexander Scott and Tom McCarthy. Next week's allocation of the Johnson & Johnson vaccine, that's still coming in full, correct? Correct. Okay, and then how is that going to change moving forward? What were we supposed to get in our next shipment and when, and how has that changed at all?
What we have thus far is that the 16,000 doses of Johnson & Johnson vaccine coming to Rhode Island next week will not be affected by the manufacturing issue that was in the news last night. It is possible that this could affect our numbers in future weeks. I was actually just on the phone with our national colleague leading the vaccine rollout prior to this press conference, and they are doing everything they can to help ensure that ultimately the doses balance out, certainly by early May or so. We expect about 6,000 doses of J&J the week after next, which is a decrease from the 16,000, but we are anticipating that there will be some updated information hopefully prior to that.
And do you think this will impact the state's timeline at all about having 70% of the population vaccinated by early July or so?
With a huge credit to the team, as Tom has mentioned, we are able to make the adjustments needed to continue with our anticipated timeline. And given the conversation that I just shared as well, the federal government is also looking to balance it out for all states as well.
Meaning boosting the Pfizer and Moderna shipments to Rhode Island.
And working on addressing the J&J as well.
Patrick and Brian?
I was going to ask about that exact thing. Are there, with travel expected over this weekend being a holiday weekend, are any different recommendations on whether folks should travel across states? You have many states, especially in the Northeast, that are having pretty decent upticks. And is there any guidance on whether people should travel out of state and back, with that being the case?
Yeah, we really want to make sure people are informed with the prevention measures that we know work. Mask wearing, getting tested before, after, and during, getting vaccinated once you are eligible. Our travel guidelines currently caution against traveling to places that have higher rates, particularly beyond 5% positivity. So making sure that you are also informed and educated about where you're going so that there can be another level of vigilance applied to keeping you and your household protected and safe is our current approach.
Are you going to change those quarantine rules?
As of now, no. We're continuing to assess.
Governor, I've heard some increasing frustration from school leaders that there hasn't been guidance on prom and graduation events, especially I know as Secretary Pryor has mentioned, they're loosening up the numbers on catered events. When will that be coming? They have to make plans if they want to book something. You know, can they have a spaced out graduation on the football field? Or if a wedding can have 200 people outside, can schools have a prom outside with testing and certain things like that?
I'd expect the updates to be coming next week on those issues. The commissioner will be here, as I mentioned earlier. We are discussing those issues right now, and it's a good opportunity to just everybody stay disciplined. The more disciplined we are, the more flexibility we'll be able to provide.
Do some of those things sound logical, though, if people are spaced out and there's testing ahead of time? Or?
Yes, I think they do. But again, we're going to make sure we're keeping track of what the infection rates look like and the hospitalization rates, which gratefully are down. You're going to see more flexibility. We just got to make sure that we keep the flexibility, people disciplined. Thank you.
Scott, if I could ask you a question. I've heard that there was a loosening of restriction on nursing homes. Are residents allowed to leave and come back now? Have you heard anything about that? Like if they want to leave the facility with families and come back?
We have worked on ways to ensure that visitation is allowed for families without the types of restrictions that were in place before. If nursing homes are using that as a way to allow for some flexibility for their residents, we can support them in doing that safely as well.
I know most of the residents have been vaccinated, and I'm sure most families would welcome that as good news that they can see their relatives more. What about people who are concerned that even though many of them have been vaccinated, you could still bring the virus in and out with more visitations, or if people are leaving the facility?
It's exactly why we want to continue to maintain screening and promote the importance of testing, talk about the fact that masks work, and make sure that people are continuing to remain vigilant with this community.
Governor, yesterday, that was a nice ceremony, and Council President Matos seems like an excellent choice for that position. When the Paw Sox left Rhode Island, we saw a real contrast where they complained that they had to go, meet with Governor Raimondo and the Senate President and the Speaker. Yet when they announced in Worcester, Governor Baker mentioned the Lieutenant Governor had acted as the point person. Are you thinking in terms of that almost transforming the way we operate government, where the she be confirmed Lieutenant Governor would almost act as your point person?
Yeah, and I think that Sabina is going to be very, very talented and skilled, so we plan to use her. But also, it's a great opportunity to show why we should be running as a team and managing it as a team. And I've been on record that should happen, and we're going to prove the case of the people of Rhode Island. We're going to insist that happens.
Can you also just, the number of people contacting your office on the climate bill that you wrote a letter, you had some concerns. Can you touch on that? And did that have any impact of business people or others reaching out to you on his proposed climate bill?
So I think that the position we took on that is that I do support the idea, obviously, of a safe environment and clean air. So, and I think that the technology that's going to be coming, I've always said publicly we should be riding that bumper on the technology as fast as it goes. It's going to go very fast, especially what the president is doing right now. My caution on there is that we've opened up as hard as you might work to make that happen in terms of the goals. That we've opened it up that lawsuits can be filed by virtually anyone, and then attorney's fees would be covered with a very low threshold in terms of, showing that it was a legitimate lawsuit. So what we're suggesting is that the General Assembly take a look and they empower the Attorney General to actually be the representative for the people as the Attorney General does in many cases. So it's the risk for the taxpayers that I see in there in terms of frivolous or even lawsuits that are going to be potentially very costly to the state. The Attorney General is certainly in a position to do that.
For Dr. Alexander Scott, on some measures, we're doing extremely well in Rhode Island. I think we're about the 5th best or 6th best state on vaccination per 100,000. But on other measures, we're doing not so well. So we're about, I think, the 5th or 6th worst state on new infections per 100,000 on a 7-day basis. And that's, as noted, I think, getting worse week to week over the last few weeks. Not terribly worse. It's a plateau, I think you described, with a slightly upward slope. Why do you think we are seeing that increase in cases and new infections? Why do you think that Rhode Island is experiencing a worse situation than other states? And what, other than the obvious public health message, such as masking, distancing, and so on, do you see as potentially fixing that or changing that or improving that? And finally, do you see that as going to make it necessary to pull back on some of the reopenings and capacity limits that we've changed?
Thank you. So one of the elements that you are calling out is the fact that we are leading the nation in testing. We have among the highest rates of states with percent positivity, but also have a high case rate. That has been consistent all along, and the specific component to the case rate takes into account the density of our state, the ability to spread more quickly when there is a variance because of that density, and the overall size of our state, among other factors. It is why we specifically focus on our percent positivity to really balance out the fact that cases are ranked in a particular way compared to other states that may not be as dense, but our percent positive is among the lowest of states across the country in that 2% range. That being said, we have also had a slight increase, as I've shared, in our percent positives. It's still very slight, but enough for us to pay attention to and to continue to express vigilance and raise awareness about the variants being present and being more transmissible. In terms of how to handle the fact that cases have increased, our team altogether have continued to do very detailed analyses, understanding by municipality, by population group, by sector, what is contributing to those changes. We definitely know that we are reopening more. We definitely know that people are tired and are, may be letting their guard down, which is why it's always important to engage all of you as ambassadors to really spread the word about being vigilant. And we know that the variant is continuing to spread and will be the dominant strain at some point early in April. So those are very understood reasons for increasing in terms of cases, but we are balancing it with having among the strongest rates of vaccine administration in the country, as well as the focus on testing, which we have maintained while other states have trickled down in terms of testing, and the focus on treatment.
Let's go to Amanda, Anita, Ben, and then Steve.
Thank you. When it comes to the Providence vaccine eligibility, can we expect any more zip codes to be added to that list?
Expect any more?
Eligibility list?
As part of our high-density community and communities of color strategy, Tier 1, we have really focused on for improving our vaccination rates. There are still some more zip codes, particularly in Providence, that we need to see improvement on. In moving into Tier 2, which are those secondary groups that are impacted, we are looking at expanding into Woonsocket and later on into the month of April, considering further zip codes, one of which is also in Providence as well.
Anita.
Dr. Cole, Dr. Scott, or Mr. McCarthy, will appointments continue to be made available on Tuesdays and Fridays, especially as the next group is available to be eligible on a Monday, I believe, and especially as we're going to be seeing it open up to everybody in a couple weeks?
That's correct. They will continue to be available Tuesdays and Fridays for the mass vaccination sites, but our pharmacy partners, other vaccination partners, they release throughout the week.
So the eligibility criteria at retail pharmacies will change midnight on Monday or later in the morning?
It will change, so first thing in the morning on Monday, so midnight, Sunday night going into Monday. They'll be eligible on Monday.
Ben and then Steve.
I don't know if this is for the governor or for the doctor. Earlier this week, there was a scathing report that came out of Massachusetts about their DCF and the death of a child where the workers weren't able to get into the home because of COVID protocols and everything. My question is Rhode Island DCYF, how close are they to getting back to in-home inspections, actually going into the home of children who have been either recently reunited or there's cause for concern? Obviously, in the beginning, it all had to get shut down, but are we getting closer to that point to actually getting the inspector physically in the home to inspect?
We have worked closely with DCYF to ensure that when they need to, in particularly urgent situations throughout this pandemic, that they are able to get into the home, have the proper support for doing so, and ensure that families are kept as safe as possible.
Steve.
Governor, do you anticipate keying into these community connections program that the White House is talking about to try to overcome reluctance on the part of some people in the community to getting the vaccine?
Well, I think we're doing that already, Steve, right? So, we've activated our local communities and all the civic leaders and municipal leaders to do just that. And so I would expect that's going to continue. I think that community leaders, if that's what you're referring to make sure that everybody is aware that the getting vaccinated is keeping them safe and keeping them healthy. So, but I would say to continue to do that. We have been talking to the White House about the various hesitancy issues, and we're going to, take whatever resources that are available. But our municipalities and our community leaders are going to play a significant role. Just like Dr. Alexander Scott said, we met with community leaders in the clergy as well as the Black and Hispanic community last week, and you saw how quickly we've been able to react to that, to that differential that we need to catch up on.
Governor, on the hesitancy issue, Health and Human Services Secretary Wamsetta Jones said at an event the other day that it's not about hesitancy, but about access. And one of the things she pointed to was perhaps some people are not comfortable going to these mass vaccination sites where there are National Guard members in uniform with guns and stuff like that. What do you say to that? And I know there's all different kinds of clinics now for people to go to, but what's your response to that it's not as much about hesitancy as it is about access?
Well, first of all our sites are safe, so I want to let people know that they're safe. They should feel very comfortable doing that. And anybody has any objections to that, let us know. But the people are going into these sites are being really welcomed, and they should feel welcome coming in. But to the point, that, as came up last week, the issue is a differential between in the Black community, Hispanic community. There is a difference right now in terms of the percentage, and we've just activated a plan to make everybody feel comfortable. Yesterday, the diversity committee that has been working for several months actually visited the Dunkin' Donut site, and I think they're going to come out of there with a good information for their communities that this is safe. And so I think it's outreach. I think that it's it's actually education, and then we're going to have a great deal of work to do as we get past the goals we're setting for early June. There's going to be many people that we're going to have to continue to reach out to make sure that they're going to get vaccinated.
Is there any thought to kind of tampering down the militarized look of some of the sites, or potentially foregoing a registration system and just letting people show up at some point to knock down a barrier in that sense?
Yeah, I think that like I said, the people who visited yesterday, I think they saw a really good, reach out to them and see what they thought in terms of those issues. I think that is an education that is safe, and people should feel comfortable using those. And if there's any areas that people feel as though that, there's too much, I guess, a sense of force or whatever you're referring to, they should let us know, because we'll certainly reach out to them and make them feel comfortable. The people who are actually at these sites, whether it's municipal pods or state sites, are doing extraordinary work, as well as FEMA is right now partnering in at the Dunk Center. So, yeah, I think that it's a communication, it's information, it's education. I think that most people will be very comfortable once they actually get involved. But we should be going out and extending our reach into communities as we get more supply, and it makes sense to do that. We're open to any way that we can get shots in the arms.
Last two questions, John. Patrick.
Governor, do you plan to attend Mass in person, or are you going to just watch it virtually?
Well, last year we didn't attend. We did virtual. I would think that I'll be attending Mass this week, but we welcome that. Everybody should be celebrating their services the way they feel as though they should. And as Dr. Alexander Scott said, virtual is the recommendation. So I guess it hasn't been decided yet in my family. I have to talk to my wife, Susan.
How was the reaction yesterday making the rounds with your choice for Lieutenant Governor?
I think it's very positive, and the reception we got in Johnston with Mayor Policina was, to show that Sabina is a municipal leader as well. All the 39 plaques are going to stay on the walls in the office that we have, and we're going to make sure that we're in every community with the Lieutenant Governor over the first 100 days in office, to make sure everybody knows that the communities are very important. So very positive right now, and I think it's going to continue that way. As my mom always said, the proof's in the pudding, and we'll actually demonstrate why we think it's very important to have a Lieutenant Governor and a Governor working very closely together.
And Doctor, last week, Governor Lamont in Connecticut blamed some of the spike there, which is, I think, even worse than here, on seasonality, on this early spring, late winter. And it occurs to me this is when it was worse last year. How much do you attribute seasonality to the uptick?
It's actually a mixture, because some of the weather improvements are actually contributing to people going outside more, which is better in terms of decreasing the risk of transmission. It does not eliminate it, but we have been encouraging taking it outdoors, taking it outside, engaging in our economy and commerce in ways that we're able to support, and doing that outdoors. The colder weather and drier climate is when you can have more risk of spread. So we'll just continue to walk the balance. We've only opened up to 75%. We wanted to stay cautious in many of our areas, but allow for some of that activity to occur. That may have been a little bit of the difference with Connecticut. And we'll continue to push on our vaccination administration rates and stay along a pace or even beyond, as they have done well also.
Thanks, everyone.